everyone, our names are Kara, Lauren, and Maddie. We are going to take a deeper look into France's healthcare system. To get a first-hand account of how it works, we FaceTimed our friend Pierre.
After each topic, we'll get Pierre's perspective. But first, let's meet Pierre.
Okay, so I was born next to Paris, and I lived there until I was 8 years old. I lived there with my mom, and that's about it. I moved to London and then to New York. I think that I like France better, but that's just probably because I was born there, so I have this attachment to it. But the US also has a lot of great things that we don't have or that we lack in.
Healthcare was influenced by World War II Germany since there was a shortage of workers due to the draft. Businesses couldn't raise salaries because of inflation, so health insurance was the new incentive to attract workers.
Just about everyone in France has access to care. Foreigners are able to get access to healthcare after 3 months of residence through the system known as PUMA. Also, for any persons whose household income falls below a certain threshold, they may qualify for free health insurance coverage through CMUC, or get help in getting additional coverage through ACS. France has universal coverage, and the majority of the healthcare visit is paid for by the government. France's healthcare is not socialized medicine like so many believe. Instead, it is funded through employers, individuals, and the government. In this healthcare system, there are both public and private health insurance options. Public health insurance is required for everyone to have, and it provides a baseline coverage of healthcare services. Unlike in the US, for any person with an illness, their insurance actually gets better. For anyone who wants coverage outside of the baseline care, they can purchase additional coverage through private insurers. For those who are not able to afford any type of health service, the government will pay it for them. The amount of out-of-pocket spending is extremely small compared to the US, but it is usually spent on dental and vision services that aren't typically covered through insurance plans. It is also part of a social security system that provides pensions, allowances, and health insurance. This chart shows the co-payment amount for different services in France. It shows both the amount of euros it would cost and also shows what that amount would be in US dollars. As you can see, the co-payment costs for these services are a lot less than what we would see here in America.
Basically, I went with my dad to get my wisdom teeth removed, and it was all four at the same time with local anesthesia. And it was like 20 minutes, the doctor just pulled them out, and at the end, when we went to pay, the total was like $130, and out of those 130, the social security will give you back like at more than 50% nearly every time. So we ended up by paying like 20 or $30 from my dad's pocket, and those 20 and $30 will then after also be given back by the government. So the healthcare system is very well taken care of and looked at in France, where I feel like it's a bit left on the side in the US.
Medical school in France is virtually free with an application fee of around $200 to $300, while the average med student in America ends up in over $196,000 of debt. Schooling is broken up into 3 cycles, the first being 2 years of general knowledge with a competitive exam at the end, the second being a year of basic medicine training followed by 3 more years of in-depth learning, and the final cycle is when the student becomes certified and chooses to go straight into residency for general practice or pursue a specialty by starting an internship.
I actually do know a lot of students in medical school, and it's way harder. It's very competitive. Medical school in France works as like literally who's the best in your grade, and so at the end of the year you'll just have those 200 first year students that will compete against each other, and out of those, I don't know how many I said, but let's say 500, out of those 500, only 50 are actually going to make it to second year. And the rest have to redo it or just give up, which is what happens most of the time. I wouldn't say that doctors are better in France than in the US, because I feel like you can't just let anyone become a doctor, so they all have to be qualified in some sort of way.
There are some disparities in France's healthcare system. For example, there is a 6.3-year gap in life expectancy for males in the highest and lowest social categories. Also, those people who are not able to afford private health insurance and only use public health insurance have poorer health outcomes. Other disparities in the healthcare system include prevention of obesity and other screenings not covered, which can cause poorer health outcomes for those at risk.
As a developed country, France's population is one of the healthiest out there. When being compared to the United States, they have better rates for life expectancy at birth, at 65 years, infant mortality rates, and years of life lost due to premature death. France also has one of the lowest rates of avoidable mortality. France has a life expectancy of 82.4 years, which is extremely high.
You'll have people that are really sick and all, but overall, everyone is pretty healthy, and that's most likely due to the fact that when you're sick, you can be taken care of without having to save up money for it, I want to say.
SHI covers hospital care and treatment in public or private rehabilitation, outpatient care provided by general practitioners, specialists, dentists, and midwives, diagnostic services prescribed by doctors and carried out by laboratories and paramedical professionals, prescription drugs, medical appliances, and prescribed healthcare-related transportation and home care. It also partially covers long-term hospice and mental health care and provides only minimal coverage of outpatient vision and dental care. For the Vital Card, interoperability is ensured by a chip. By law, patients have full access to the information in their own records, either directly or through their general practitioner. It is necessary for residents to have this card in order to receive the benefits that France's healthcare system has to offer.
It looks like a little debit card.
Yeah, so this is pretty much what you used to as like you kind of have to have one if you live in France. That's what allows you to have access to all those reimbursement and etc. that comes with healthcare. So it's very important.